Welcome to The Vast Majority. I'm Jacobin managing editor Micah Uetricht, recording from coronavirus quarantine where the audio quality is decidedly low. Apologies for that. We obviously aren't going into our studio right now, so you're getting much worse quality than you usually do. Coronavirus is decimating the planet right now, and we're left flat-footed because we don't have a public healthcare system like Medicare for All, or a robust public health system generally, which is the topic of my conversation with Adam Gaffney. Adam is the president of Physicians for a National Health Program, as well as a pulmonary specialist at Cambridge Health Alliance and the Harvard Medical School. He's the author of To Heal Humankind, The Right to Health in History, and he's a regular contributor to Jacobin. Before we go to my conversation with Adam, it feels a little absurd and self-indulgent to talk about anything other than coronavirus right now, so apologies for that. But I do want to mention that the book that I co-authored with Jacobin staff writer Megan Day, called Bigger Than Bernie: How We Go from the Sanders Campaign to Democratic Socialism, has had its release date bumped up to March 24th, given the developments in the Democratic primary. So please, if you have the money, and since you're probably tired of watching Netflix under quarantine and maybe want to read a book or two, pre-order Bigger Than Bernie from the Verso Books website, versobooks.com. Coronavirus is making literally everything else that we were talking about even just a few weeks ago seem minuscule and worthless, but it's also true that if we're going to get out of this crisis, we need to take the lessons that we learned out of the Bernie Sanders campaigns and run with them to demand things like Medicare for All and a whole lot more. And we sketch out how exactly to do that, how exactly to build that movement in the book. So again, go to versobooks.com and pre-order Bigger Than Bernie by me, Micah Uetricht, and Megan Day. It's currently 20% off. Thank you. Okay, here's Dr. Adam Gaffney. Adam, hello.
Micah, thanks for having me.
Well, thanks for taking the time out of what is a pretty harried time, I'm sure, for a doctor like you. So let's just start with the basics. I mean, what's your initial thoughts on what's going on right now? Big picture, how are you feeling?
I mean, big picture is that there is massive uncertainty. We know that, COVID-19 can be devastating if it gets out of control, as happened in Wuhan, obviously. And we know it can be contained as well, as we're seeing play out in places like South Korea, Taiwan, Hong Kong, Singapore. And so, how things are going to play out in the United States, I am not entirely sure. You've probably heard the expectations that there's, a lot of concern that there could be a surge in cases, there could be a surge in hospitalizations, there could be a surge in intensive care unit admissions, and so forth. And so I think overall we have to prepare for the worst, generally speaking, and that makes sense. But how things play out exactly, no one's sure.
Now, you're a doctor who's very prominently argued for Medicare for All over the last couple of years. Can you just talk about, I think people, especially listeners of a podcast like this, know that Medicare for All would be a better system to have under a pandemic like this, but lay out the basic case of why we need a public health system, especially in the middle of a pandemic like this one.
Absolutely. And I'll preface that with one statement, which is that let's keep in mind that the response to a pandemic, part of it is through the Medicare medical care system, in which hopefully will be Medicare for All. But the public health response from the federal, state, and local public health authorities is just as important. And that's true for any sort of occupational or environmental or new epidemic threat. So, unfortunately, we've shot ourselves in the foot with a 12-gauge shotgun on that one as well, because we've been underfunding our public health authorities, for a long time. So that is one sort of thing that we should mention, is that the public health response, which is separate from medical care, is critical and something that also needs to be completely transformed, and we need to increase funding for our public health authorities, and that's one important thing.
And before you go on, so then can you just talk about that distinction a little bit and like what, I think people have obviously in their minds that Medicare for all is desperately needed in this situation for some obvious reasons, but what would a transformed, a robust public health system look like, and what is the one that we have right now?
Well, I think one that we've had now has just been encumbered by cuts, by inadequate funding. I mean, you see this with the shoddy rollout of the testing, fiasco, right? When Trump came into office, he had a hiring freeze that lasted much of 2017. There was almost 700 vacancies at the Centers for Disease Control during that period. You've probably heard that he disbanded the office that focuses specifically on pandemic response. The kinds of surveillance, testing, awareness, preparation activities that have to happen are, all sort of separate from obviously interacting with, but somewhat separate from the kinds of stuff that I do, say, that's just actually the delivery of healthcare. And so it's not, I don't want to draw too fine of a distinction, but these are two different things, and traditionally are done by different bodies.
Yeah, so we've got a private health system that we all know all of the horrors that causes in terms of medical care being totally insanely expensive and all the rest of it. But then there's also this public health system that's been basically ravaged by austerity in the United States. Okay, so let's go back to what a Medicare for all system, aside from the public health response, what a Medicare for all system would be able to do, or how it would look differently in handling a pandemic like this.
The obvious first answer is that to control a infectious disease epidemic, you need to, like this one, a viral respiratory epidemic, you need to find cases, you need to diagnose people, and you need to then be able to isolate them. Now, obviously, if people are afraid to come to medical care because they're going to get slammed with a $1,000 or $10,000 bill at their local ER or hospital, that's going to prove to be a major deterrent in actually getting everyone tested and treated who needs to be tested and treated. And in fact, when NBC sort of interviewed a spokesperson from Taiwan, one thing that that person said was that, at least he or she felt that the free availability of care and testing did help their response, at least to some extent. So there's no question about that. Now right now, the major bottleneck has been the absence of tests altogether, not so much the cost of them. But that's going to change as tests become widely available, and you're going to see cost-related barriers playing a big part. A second thing, though, is that, look, this hasn't really hit us yet, right? I mean, it's hit us psychologically, but the number of cases, the number of hospitalizations has been, relatively low so far. You could imagine that if sort of the worst predictions came through, if millions or tens of millions of people are hospitalized, you're talking about an enormous number of people who are going to be uninsured or underinsured, hospitalized for pneumonia, and that can be financially ruinous. As we know by the fact that if you're uninsured, hospitalizations can easily get into the tens of thousands or hundreds of thousands of dollars, and even if you're underinsured, an $8,000 deductible can be ruinous. And there's that Federal Reserve survey from last year that found that like 1 in 4 families couldn't afford a $400 sort of emergency expense without, borrowing money or something like that. So this is not money that people have lying around. And furthermore, we seem to be probably heading into a massive recession. There's going to be massive job loss. People are not going to stop getting sick of other things like heart attacks, cancer, other types of pneumonia, and bullet wounds. And they're going to be immiserated as well by the medical care system if we don't have universal health care, if they're uninsured or underinsured. And there's going to be more uninsured people given the way things are going with the economy and the response. And so, whether you have financial ruin from COVID-19 pneumonia or you have financial ruin because of the medical expenses from the COVID-19 recession, either way, that's a bad thing.
In the recent debate between Joe Biden and Bernie Sanders, Biden mentioned at one point something about Italy not, Italy has a public health system, and yet COVID-19 is still ravaging the country. Yeah, which I mean, that was probably the point of the debate when I was screaming at the TV the loudest. But explain why that is an absurd point for someone like Biden to use as a cudgel against Medicare for all.
I mean, it's just an absurd point because obviously a Medicare for all system is not going to turn back a viral respiratory virus, just like it's not going to turn back, an earthquake or a volcano or tornado or a zombie apocalypse.
Yeah. The United Kingdom has the NHS, and yet somehow people still get cancer.
Exactly. I mean, I think the obvious example is HIV, right? I mean, obviously HIV has been in every country in the world. There's no stopping that. But for a long time, we were, a country where people were dying because they couldn't afford the drugs, right? And in many cases, that's still true around the world. Yeah, you're still going to have that epidemic, but you're going to ensure that people are actually being treated. And even if there's not great treatments, at least they're not going broke being treated. So no one in those Italian hospitals, at the very least, they're not going to be ruined financially because they were hospitalized. And that we can't promise that here. So I think that's one side of the story. The second side of the story, I think, is the fact that, our whole healthcare system is so market-based in the sense of the fact that, where we have hospitals, where we have ICUs, who has ventilators, is all being sort of driven by market dynamics. And that means that it's irrational. Just to give an example, one of the things in the news the last couple of weeks, that a statistic that has been cited frequently, is the fact that the U.S., has sort of less hospital beds per capita than many other countries, and people have done sort of calculations about how that's going to play out if there was a big need for more hospitals. And you might ask, well, why is that? And it's funny, not funny, but it's true that it's coming on the heels of years of news about rural hospitals closing. Hahnemann Hospital, which was a sort of safety net hospital in downtown Philadelphia, closed last year. Bernie Sanders had a big rally outside of it. You probably remember that. It's not because it was a rational decision that we needed less hospital beds because people were being hospitalized less. It's because of market dynamics. Those are hospitals that are unprofitable. So we have less hospital beds. It turns out we actually have more ICU beds per capita than most other countries. Some argue too many, but though right now that's probably a good thing. But we also know that there's huge disparities between places. And that's, again, because of the fact that where new healthcare infrastructure appears is driven by market dynamics, not by community health needs. So we might have enough sort of for the country, but we don't know that we have enough in the right places because we're not actually planning healthcare infrastructure. And a Medicare for all system, beyond giving first dollar coverage, which is what we focus on most, I think, in our advocacy, it also means planning of healthcare infrastructure based on community need, not based on where profits happen to be.
Well, and obviously, when you're having that discussion, you're getting into the discussion of how socialists argue that we should be dealing with society generally, right? That we need to have planning rather than just tossing things over to market forces and letting them work their magic, their black magic in many cases. So the thing that I think came to my mind very quickly once this pandemic was going, and what others have mentioned too, is a kind of like a left-wing version of a shock doctrine. The idea that was made popular by Naomi Klein, but using this pandemic as a kind of shock doctrine for the left, using this pandemic as a way to advance the kinds of things that can address health crises and all the other crises that we all know that we already face in society. And so I'm wondering about that with Medicare for All specifically. Are there ways that a response to coronavirus can long-term or medium-term or short-term advance the cause of winning a public health system, a single-payer system?
Yeah, I mean, I think none of us know what the effect will be on our politics or our policies, but we absolutely should make the argument that disasters like this or other types of crises or whatever epidemics are coming down the road would be better handled with a national health program with unified governance and unified financing. and which is Medicare for all. And so we certainly should be articulating those arguments, especially because people are going to be looking for answers. I mean, there's going to be a lot of pain ahead, in my opinion, regardless of what happens with the actual coronavirus, given the sort of economic disaster that this is going to prove to be. So yes, we have to make those arguments.
But I guess what I'm wondering is, like, what are the specific ways that we could do that policy-wise? I mean, today in Jacobin, for example, today on Thursday, the day we're recording this, Dustin Guastella makes an argument to do an emergency expansion of Medicare to cover costs for treatment and testing for all citizens. And it's easy to see. I mean, that seems like a no-brainer. Obviously, that's what we have to have in order to help stop the spread of the virus. But there are also ways where if we establish that emergency expansion, it's easy to see that becoming a more permanent part of the American health system.
Yeah. I mean, I think there have been proposals like the one you said, which sounds more expansionary. I mean, in the House bill, the coronavirus bill that the House passed on Friday, they also include sort of free coverage of testing, but they left out treatment, and I think treatment's critical. I certainly would be in favor of, and I think we can advocate for those kinds of incremental expansions. Obviously there's something very arbitrary about, if you come in with severe pneumonia from influenza, that you could be broke, but if you come in with severe influenza from coronavirus, you'd be covered. And I'm not saying I'm against doing that, obviously, but yes, I think we can and should, make those demands for those kinds of incremental changes. I don't know. And there may be some appetite for it, in Congress, but obviously we have to go beyond that.
You mentioned earlier the necessity of planning in response to something like this. I mean, this isn't quite your area of expertise, but it seems obvious that the kind of World War II style requisitioning of industries, even nationalization of industries, whether temporary or permanently, has to be done to shift production to moving to things like expanding the production of ventilators, right? Which there's been all kinds of talk about there not being enough ventilators, and certainly not enough ventilators for what is probably going to come, this huge spike in cases of people with the virus who are going to need ventilators in order to live, and the free market has not produced enough of those right now. So that seems like the kind of thing that is desperately needed to be a part of that kind of planning, and to do that kind of planning, you need government to take over some of these industries.
Yeah, I mean, I think at the end of the day, if we're really talking about a looming catastrophe where we're going to be, rationing who gets a ventilator because we can't, the industry hasn't produced enough, then I think those kinds of, World War II types of measures make sense. I think that there's also the sort of healthcare financing bit of this, which is putting aside the fact how many ventilators there are. Where are they going? Why is it that we have hospitals acting sort of as atomized forces, each trying to sort of bid for ventilators separately? We could given the way our hospital financing is set up, we may very well have a scenario where there's unused ventilators at one hospital and a paucity elsewhere. So I mean, I hear the sort of supply side arguments, and I think if we're really in that situation, then we have to do what we have to do. But we have to also think about the distributive kind of aspect of this. And if you had a rational sort of unified healthcare system, you'd actually know, where the ventilators need to go, which hospitals have them, which hospitals need more. Can we shift some from one to the other? Like many things in American society, and this may be one exception because it's such a sort of, once in a lifetime kind of event, but putting aside COVID-19 for a moment, most things in American healthcare, we have the resources and the financing and the funding and all that in terms of its aggregate. It's just that it's being distributed and made available in all the wrong ways. And so I think in general, that's the bigger problem in healthcare financing. There may be certain exceptions as we're dealing with today.
What's the role of someone like Bernie Sanders in a crisis like this? I mean, the article I mentioned earlier by Dustin Guastella is called "We're at War with Coronavirus, and Bernie should be our general." It seems like the Democratic Party's response, in some cases, I mean, they've been outflanked by the Republicans from the left in some cases, in terms of, for example, the proposals for basic income payments to Americans. I mean, the Democrats have been incredibly miserly on the stuff that they have put forward, and the Republicans have produced proposals that are proposing more money for Americans. I mean, when I heard that, I was like, oh my God. I mean, November, assuming we still have an election in November, Donald Trump, I mean, he could, that's the best gift that could be given to Donald Trump, is that Democrats refuse to put forward a kind of bold proposal on something like basic income payments to Americans. Trump proposes a bolder one, and then Trump wins in November. What's your response to the sort of how the Democrats have responded to the crisis so far, and what the role of a Bernie Sanders or an AOC or an Ilhan Omar or any of these new left elected officials can be and should be?
Yeah. Well, I mean, I think that you hit the big points here. I mean, first, I would just say we can't underestimate, the fallout from our response to COVID economically. Where things are heading now, projections are deep recession, and I think that Republicans see that, and so they're coming out with a very sort of populist package that's sort of outflanking the Democrats. And I don't think the Democrats can sort of swing left enough on this. I think that they need to realize that these public health measures alone are going to be devastating to people, and if we're going to do them, we need a extremely aggressive welfare state expansion, all the kinds of things you're talking about. And I think it's a very dangerous moment politically because of that, because we don't know, what's going to happen, what they're going to do, what they're going to propose, and if they will be outflanked by Trump on that question.
So one of the essential pieces of responding to this crisis is not just the immediate frontline care to people, of course, that we've mentioned, the provision of ventilators and treating the people who are already infected, but it's also the development of a vaccine, and I assume other kinds of drugs that can respond to this. And this is an area where the free market failure in providing for human needs seems the most clear, because it seems like you can't rely on the government to develop these kinds of vaccines or medications in response to you can't rely on the free market to rely on developing these kinds of vaccines and medications, because it's just not profitable for these companies, right?
Yeah, I mean, I think it depends. Sometimes there are highly profitable vaccines and drugs. Sometimes they're not, and they get neglected. But the larger question, I think, really is, why don't we just fund the development of our drugs and our pharmaceuticals and our vaccines directly, as we often are already doing to a large extent, and then keep those drugs and vaccines in the public domain so that they can be sold at cost when they're made, right? I mean, that's the fundamental problem. We already fund most of the basic science behind drugs and behind vaccines, and then the pharmaceutical companies swoop in at the last minute to develop the sort of late stages of the development, own the patents, and then basically can charge us anything they want. And that is what creates the artificial shortages in drugs. That's why people go without needed drugs, not because they're expensive to produce, but because the pharmaceutical company owns a patent. So what we have proposed in PNHP and others certainly is moving towards a model of direct public drug research and development all the way through the process, so that we really live up to that kind of "could you patent the sun" mantra of the Salk vaccine, where we keep it fully in the public domain. And I think that's where we really have to be heading.
Can you explain that last part of what you mentioned, the "can you patent the sun," and how that relates to this?
It relates to it. I mean, Jonas Salk developed the polio vaccine. was once asked, who owns the patent on the polio vaccine, and said something along the lines of, no one owns it. The people own it. Could you patent the son? And the idea is that our current patent-driven model of drug development, which is basically we say, if you develop a drug, you get the patent, you can sell it wherever you want, and that's your incentive for developing it. And we've done that for many years now, and it's resulted in enormous amounts of profits for the pharmaceutical industry, but unaffordable drugs for everybody else. That's actually not necessary. People, scientists would be happy to work to make cures without the promise of billions of dollars in down the road earnings. So we could just sort of take the NIH, the National Institute of Health, which does a lot of basic science. We could expand its mission to have them also fund drug development through the whole process. And then the products of that, the research of that, the new drugs would just be produced at cost, not at the enormous, jacked up artificial prices that we see today.
So it sounds like we've got our list of demands going forward for the coronavirus. We obviously need a move towards Medicare for all, whether that's through an expansion or dramatic expansion of Medicare or some other means. We need to change the public health response, obviously, and we need a public ownership and development, and then keeping the development of drugs and vaccines out of the hands of the people who want to be corona profiteers. This should be easy enough, right?
It's just a few modest demands. I mean.
Well, Adam, thank you so much.
Thank you for having me.